Section A. Okay. Section A. Question 1 reads, a slave who commits suicide to end his or her life in order to escape the hard labor is fatalistic suicide, egoistic suicide, anomic suicide, or altruistic suicide. What is the answer there? Time up. What class of drugs is tenofovir? A. NRTIs, B. NNRTIs, C. PIs, D. IIs. What is the answer?
Yeah.
Correct. A form of arthritis characterized by severe pain when too much uric acid crystallizes and deposits in the joint is called osteoarthritis, rheumatoid arthritis, gout, or psoriasis. What is the answer? Gout, correct. Which of the following is the smallest bone in the body? Malleus, incus, stapes, or tarsal? What is the answer?
Steps.
Correct. The drug which is used in cases of severe eclampsia is magnesium hydroxide, magnesium oxide, magnesium sulfate, magnesium trisilicate.
C.
Magnesium sulfate, correct. Edwards syndrome is also called trisomy 16, trisomy 17, trisomy 18, or trisomy 19.
Trisomy 19.
Incorrect. The answer is trisomy 18. Which of the following is not a peptide hormone? Glucocorticoid, growth hormone, adrenocorticotropic, cholecystokinin.
Yeah.
Correct. Glucocorticoid. The most convenient point for recording pulse is radial artery, brachial artery, temporal artery, or femoral artery.
Yeah.
Correct. Radial artery. Which of the following surgical suffixes mean to suture? Hathi, pexi, plasti, or tomy?
Yeah.
Hathi, correct. Which of the following antihypertensive drugs is a calcium channel blocker? Furosemide, atenolol, hydralazine, nifedipine.
Nifedipine.
Correct. The type of diarrhea caused by rapid movements of food through the intestines in which there is reduction in time for absorption to take place is called osmotic diarrhea, exudative diarrhea, motility-related diarrhea, or secretory diarrhea.
C.
Motility-related diarrhea, correct. Which of the following is a local cause of epistaxis? Hemophilia, nos digitorum, hypertension, or leukemia?
Hypertension.
Incorrect. The answer is B, nos digitorum. Which of the following instrument is used for examining the ear? Tonometer, otoscope, goniometer, rhinoscopy?
Otoscope.
Correct. B, otoscope. Paradoxical chest wall motion is very diagnostic of hemothorax, lung contusion, diaphragmatic rupture, or flower chest?
Flower chest.
Correct. What is the normal intraocular pressure? 10 to 21 millimeters of mercury, 10 to 30 millimeters of mercury, 8 to 10 millimeters of mercury, or 20 to 25 millimeters of mercury?
8 to 10.
Incorrect. The answer is 10 to 21 millimeters of mercury. A. Which of the following is a disaccharide? Fructose, galactose, glucose, maltose?
Maltose.
Correct. D. Which of the following is not an ocular muscle? Posterior rectus, superior rectus, inferior rectus, medial rectus?
Rectus.
Incorrect. The answer is A, posterior rectus. Lactose is the combination of glucose and fructose, glucose and galactose, glucose and maltose, glucose and sucrose?
B.
B. Glucose and galactose. Correct. Fats are emulsified by lingolipase, pancreatic lipase, bile, cholecystokinin.
Wow.
Correct. The placenta is formed from which of the following? Inner cell mass, trophoblast, deciduum, or chorion?
Trophoblast.
Correct. How many clans profiling categories are there in family planning? 3, 4, 5, or 6?
4.
Correct. Which of the following is not a characteristic feature of physiologic jaundice? It appears within 24 hours of age. It is not detectable after 14 days. It disappears without any treatment. Serum bilirubin levels never exceed 15 mg per deciliter.
A.
Correct. It appears within 24 hours of age. How long is the gestational period of a full-term pregnancy? 260 days, 270 days, 280 days, 290 days.
270.
Incorrect. The answer is 280 days. What structure is found on the posterior aspects of the heart? Lungs, vertebral column, sternum, diaphragm.
Vertebral column.
Correct. Which of the following is not a refractive error? Stye, astigmatism, presbyopia, or myopia?
Stir.
Correct. A disease that affects a large number of people within a community is called pandemic, endemic, outbreak, epidemic.
Endemic.
Incorrect. The answer is epidemic. Which of the following cranial nerves control eye movement? Trochlear nerve, vagus nerve, olfactory nerve, glossopharyngeal nerve? Trochlear nerve. A. Correct. A set of ideas or a plan of action that has been agreed officially by a group of people in an organization to reach its long-term goals is called legislation, policy, regulation, or legal?
Policy.
Correct. The dialysis of choice in children is peritoneal dialysis, hemodialysis, cranial dialysis, simple dialysis?
Peritoneal dialysis.
Correct. Fungi that live on nutrients from dead plants or animals are called filamentous, parasites, saprophytes, unicellular?
Saprophytes.
Correct. Running from your own shadow, thinking it's a ghost, is an example of hallucination, illusion, elation, or loosening of association?
Illusion.
Correct. Elevated levels of urea and other nitrogen compounds in the blood is called azotemia, amotemia, arotemia, uretemia?
Azotemia.
Azotemia, correct. A fungi differ from bacteria in that fungi are antigens, parasites, pathogens, prokaryotes? It's time up. The answer is parasites. The discovery of penicillin is associated with Fleming Alexander, Jenner Edwards, Koch Roberts, Lister Joseph? Fleming Alexander, correct. The Necessary documentary was discovered in which year and by who? August 2019 by Chippominder, September 2019 by Chippominder, October 2019 by Chippominder, December 2019 by Chippominder. For it's time up for this question. Dash are the most common fractures in children: pathological fracture, compound fracture, torus fracture, comminuted fracture? Torus fractures. C. Correct. A feeling of having already experienced the present situation is called echolalia, neologism, anhedonia, deja vu? Incorrect. The answer is deja vu. D. Who discovers the circular arteriosis? Thomas, Judas, Simon, John?
Thomas.
Correct. Thomas Willis. Black and white thinking is very characteristic in histrionic personality disorder, borderline personality disorder, antisocial personality disorder, or paranoid personality disorder?
D.
Incorrect. The answer is B, borderline personality disorder. A serious disturbance in mental abilities that results in confused thinking and reduced awareness of surroundings is called dementia, bipolar, delirium, mania.
D.
Mania. Incorrect. The answer is C, delirium. Dash occurs when the fetus dies and is retained in utero together with a placenta and membranes for 2 months or more after the death of the fetus. Missed abortion, inevitable abortion, septic abortion, or threatened abortion. Missed abortion. Correct. Aggression aims at obtaining an object, privilege, or space with no deliberate intent to cause harm to another person is called hostile aggression, relational aggression, retroaggression, instrumental aggression. It's time up. The answer is D, instrumental aggression. School sores is also known as acne, impetigo, boil, cellulitis.
Acne.
Incorrect. The answer is B, impetigo. The surgical removal of the entire breast tissue along with the axillary contents such as fat tissue and lymph nodes is called Patey's mastectomy, Hastate's mastectomy, simple mastectomy, quadrantectomy. Patey's mastectomy. Correct. Using Parkland's formula, how much fluid are you going to administer to a patient weighing 60 kg with the bends of the face, neck, right arm, and posterior trunk? 8,600 mils, 8,640 mils, 8,680 mils, 7,000 mils. It's time up. The answer is B, 8,640 mils. Which of the following is alkylating agents? Methotrexate, vincristine, cyclophosphamide, doxorubicin.
B.
Vincristine. Incorrect. The answer is C, cyclophosphamide. Bleeding from the uterus that occurs between periods or every few weeks is called oligomenorrhea, menohagia, metrohagia, menometrohagia. It's time up. The answer is C, metrohagia. The mutation changes in sickle cell disease is due to displacement of glutamic acid by valine acid, formaldehyde acid, acetic acid, or folic acid. It's time up. The answer is A, valine acid. Paralysis of the both lower limbs is termed as paraplegia, quadriplegia, tetraplegia, hemiplegia.
Yes.
Incorrect. The answer is A, paraplegia. Chancroid is caused by Treponema pallidum, Trichomonas, Neosira, Haemophilus ducreyi.
Yeah.
Haemophilus ducreyi. Correct. The type of abortion in which a woman has had 3 or more consecutive or successive abortions is called
Habitual.
habitual abortion. Correct. The tool that is used to record the progress and salient features of labor is
Patoblas.
correct. Artificial rupture of membranes is known as
Amnioton.
correct. The seizures that persists for at least 30 minutes or is repeated so frequently that recovery between attacks does not occur is called
Status epilepticus.
correct. Heart disease that comes about due to long-standing lung disease is called
Copulmonary.
correct. The type of sound described as drum-like, loud, and quality felt over gas-filled stomach, intestine, or pneumothorax which is heard during percussion is called tympanic sound. Correct. In renal failure, urea is excreted in sweat and crystallizes on the skin to form
uremic frost.
Correct. The term used to describe the inability of the lower esophageal sphincter to relax and let food pass into the stomach is
Achalasia.
correct. Dash is a tool used to provide a reliable, objective way of assessing and recording the conscious state of a patient, which indicates the overall brain function or dysfunction.
Glasgow Coma Scale.
Correct. Dash are extremely dilated submucosal veins in the lower third of the esophagus.
Esophageal varices.
Correct. Dash is a perception or experiencing of an event or situation as intolerable difficulty that exceeds the person's current resources and coping mechanisms.
Defense mechanism.
Incorrect. The answer is crisis. The code of good manners or rules of common courtesy are called
Ethics.
incorrect. The answer is etiquette. The study of distribution and determinant of disease in a given population is called
Epidemiology.
correct. The medical term for hardened mass over feces is called
Constipation.
incorrect. The answer is feculates, a condition in which the normal contractile movement of the intestinal wall stops is referred to as
Palatic ileus.
correct. Cholera was discovered by time up. The answer is John Snow. An average calculated blood pressure in an individual during a single cardiac cycle is called time up. The answer is mean arterial pressure. The sinoatrial node or SA node is also known as, the answer is pacemaker. The increase of food nutritional value by adding vitamins or minerals to it is called time up. The answer is fortification. Restoration of normal anatomical position and alignment of fractured bone is known as
Traction.
incorrect. The answer is reduction. We have come to the end of this quiz. Okay, wow, that was awesome.